Well, good afternoon and welcome to H360 Live. My name is Dave Duplay. I'm joined here in the studio this afternoon with my friend, my colleague from Healthy h360, Miss Courtland Long. Courtland, how are you today?
I'm well, Dave. How are you?
I'm doing fine. It's so good to see you. How was your weekend?
My weekend was fantastic. My brother was in town and it was really awesome to be able to spend some time with him, watch him on the drum kit. He was great.
Yeah, so it was fun to spend some time with him and get to know him a little better. He is a phenomenal drummer. We spent Saturday in the studio recording a song for 4 Chords for Cancer, something that we have going on that's going to be a surprise that'll be coming up for our audience. And then we topped off the day by going to watch ballet next, which was over the top great.
Yeah, it was an amazing performance at New York Live Arts. Fantastic. And Casey was blown away by that as well.
He was. The dancers combining, you know, other arts with dance. It was really something amazing. And what I didn't know was the jazz part of it. It's improv. It's different every night. So could you imagine?
The pressure must be on for that.
Yeah, and they did such a great job. It was a lot of fun. Well, we have a very exciting show for you today. We have Dr. Myla Lai-Goldman coming into the studio. She is the founder, CEO, and president of Genecentric out of North Carolina. They are doing some unbelievable work. I can't wait to get her in here because they and everybody were working to make cancer a chronic illness. And you'll see in a very short period of time what they're doing and the work that they're doing to achieve that goal. Well, Courtland, as always, we have an interesting health topic that we want to discuss, some health tips.
Yes, we do. Well, you know, we hear all the time in the news that having a sedentary lifestyle is very detrimental to your health. And having a desk job where you have to sit at your desk for about 8 hours a day is also quite detrimental. But rather than talking about everything negative that happens, we're actually going to emphasize some positive things that you can do to counteract those negativities. And so it's not necessarily the sitting position that is bad for your health. It's more that most people don't take a break to exercise during lunch or after their job.
Yeah. So here we go. Here's tip number 1, and I think this is good. You know, you and I both wear these devices on our wrist that kind of tell us when to get up and stand and how much we're moving or not, right, during the course of the day.
Gives me a little buzz.
It gives you a little buzz. Says, get up, get on, you know, come on, you got to get moving, right? It's good for your health. It's good for all the way around. But the first tip is to take a walk to speed up digestion. And so after a meal, after your lunch, after dinner, go for a walk. It doesn't have to be a long walk. In the summertime, I really enjoy, after my lunch, taking the elevator down, taking a walk twice around the block. It's very refreshing. I'm also getting some vitamin D because the sun's out. I feel great about it. In the wintertime, when it's snowing, not so much. I'll walk around the halls, or what I'll do is I'll actually go in the stairwell and I'll climb a flight or two. It's going to help your digestion unbelievably. It's also good for your heart. And, you know, for those of you living with diabetes, exercise is so key to the therapy regimen for that. So you got to get up, you got to, you know, walk around, take a break from your work and move. It's going to help you in many, many ways. Yeah,
getting in that vitamin D is really important to your health. You know, vitamin D, especially in women, is what helps to unlock the calcium within your body. So get out there, take a walk, soak up some sun. It's awesome. But tip number 2 is to consider taking a walk to release some creative insights. This will help break up the monotony of the day and also take a break from the computer screen that is probably putting a lot of strain on your eyes.
You know, some of the most creative thinking I get is when I'm walking around, right? Especially on the streets of New York, because you really see some characters. And you also see some fantastic architecture, which really spawns my thinking and my creativity. Then I come back to the office and I run a few things by you guys. Some of them stick, some of them, Dave, back to the drawing board. But nonetheless, I agree with you on that point. Do we have one more?
Yes, well, our third tip is to walk with someone. Now, this will help to reduce your stress. This person can also be a sounding board for things that are going on throughout your day. And if it's a significant other, you can hold hands, as some studies suggest that physical touch will also help to relieve your stress because your body may try to sync up heartbeats and let you know that you're not alone.
Seriously? Sync up, hold hands, sync up?
Some studies suggest, yeah.
Okay, I'm gonna look for that study. I really want to know how this works. You know, walking in the streets of New York City holding hands.
Yeah, that might be a
Although
little
we've never
dangerous.
done it, I want to make that clear right now. We've never done it. So, Mom, if you're watching, you know, that could be tricky because people are trying to get around in this. You know, the sidewalks are so narrow, and there's always construction. So, if you're going to do that, maybe go to Central Park, go to Bryant Park. You'll pick a nice area. Hold hands, sync up heartbeats, good and good for you.
Yeah, we have tons of beautiful parks here in the New York City area, so try to take advantage of those awesome outdoor spaces.
Beautiful, right? Especially in the fall, this time of year.
Oh yeah, with all the leaves changing.
Yeah, going for a nice walk, it'll pay off.
Great.
Okay, well, Courtland, as always, we sent the interns out on the streets of New York City to see just what our friendly New Yorkers know about some of these health tips. Are they, you know, putting them to good use? What's going on here? And we've got a great video. You want to watch it with me?
Would love to.
Okay, Maddie, please roll the tape.
Some of the more advanced wearable devices alert you whether or not you've been sitting down for a really long time, such as the Jawbone, a Fitbit, or even an Apple Watch or any other devices. Do you wear any of those?
I don't wear any of those, although I would like to. I think I want a Fitbit. I just like the stats based on how much you walked and all that information. Seems interesting to me.
I use my iPhone to see how many steps I've been doing at the workplace, so I guess that's in a way showing me how much I've been sitting, but yeah, not directly.
I do not wear any of those devices.
No, I do not.
Do you work at a job that requires you to sit at a desk for a long period of time?
No.
Yes, I go to school and I usually have to sit in a chair for about 3 to 4 hours.
So I'm a programmer, and usually we would be sitting at the desk all day, but I use a standing desk for that exact reason. Like you see, I come out for a walk and a nap in the middle of the day, so I definitely try to stay active for like the reasons that you're highlighting.
I'm a college student, so I have numerous lectures throughout the day, like 3 lectures throughout the day, each spanning 2 to 3 hours each day. So I don't really have any breaks in between, so approximately almost half of my day I'm in a classroom just sitting down, just taking notes in a lecture.
How often do you give yourself a break to walk around and stretch your legs?
Maybe once in 3 hours.
Every hour, but I'm probably walking around stretching them a lot, so.
Probably once every 2 hours.
It honestly depends. I usually push my body to the limit of how long I can withstand something. So if I'm in a lecture and then back-to-back lectures and I know I need a break, or my body's aching and it's in pain, it's not really feeling well, I'm gonna have to get up and at least clear my mind, take a walk and relax, so that I'll be able to jump back in once I get back in class.
Do you feel more creative when you're walking around?
Yes, definitely more creative. When I'm sitting, I just get bored and antsy, and then I'm not as creative or as effective. So.
Yeah, certainly. It's pretty much to get into a different space. So I'm in the office the whole time. I feel like my brain gets a little dull.
I feel more creative going on a walk because usually all of my imaginations, ideas usually come when I'm walking around. I could just be walking down the street and then I look at something and initially get an idea from that.
Yes. Yeah, it gives you time to think and be away from whatever else you're meant to be thinking about in the workplace. So, yeah, creative, I think that's fair enough.
Courtland, what do you think?
Oh, that was a great video. You know, we had some students in that video, which I'm not sure we've had very many before, and some of them really had some comments about having to sit for so long during lecture.
Now, do you really think students are sitting that long?
Well, yeah, a lecture can be 2 or 3 hours long.
Really? I don't remember it being that long when I was in school, quite honestly.
Maybe it's changed a little bit.
What are you trying to say?
Nothing.
Oh, my little watch just went off and said it's time to stand up. So this is where I exit stage left after that comment. No, it was really good. They are, our New Yorkers always seem to be on top of things. And you're right. Some of the students had some very insightful things to say. So all the way around, it was a good video. Our interns once again did a great job.
Yeah.
Our New Yorkers did not disappoint. Courtland, now is always our favorite time of the show, right? We have our guest coming into the studio. She is Dr. Myla Lai-Goldman. as she makes her way into the studio, I just want to give you a little background because she's really has a very, very impressive resume. As I mentioned earlier, Dr. Lai-Goldman is the founder, Chief Executive Officer, and President of Genecentric Diagnostics. Dr. Lai-Goldman spent more than 18 years at LabCorp, the last 10 years as Executive Vice President, Chief Medical Officer, Chief Scientific Officer. She's also served on LabCorp's Executive Management Committee with strategic and operational responsibilities. Her experience includes the development of partnerships, licensing, and acquisitions. She brings this to her new role at Genecentric. Dr. Lai-Goldman received her bachelor's degree from the University of Pennsylvania and her MD from the Columbia University College of Physicians and Surgeons. She is board certified in anatomic and clinical pathology. Dr. Lai-Goldman, thank you so much for coming in, making your way all the way up from North Carolina to spend time with us. I really do appreciate it.
Thank you, David. It's a pleasure to be here.
Now, you guys are really doing some fantastic work there, and I don't want to let the cat out of the bag by sharing that because you have such a great story to tell, both in terms of your business, your education, your business acumen, but you also have a very personal story that you shared with us before the show that has really captured my attention because at Healthy h360, we're all about patients and caregivers. So if you wouldn't mind, maybe we could start by having you just give a little bit of an overview of Genecentric, what your mission is and the purpose of the organization.
Yes, of course. Thank you, David. Genecentric Diagnostics was founded in 2011 from the science of Doctors Chuck Peru and Neil Hayes from the Lineberger Cancer Center at the University of North Carolina. Both Doctors Peru and Hayes really doing pioneering work in defining cancer subtypes. And these subtypes have been found to be really instrumental both now and in the future, we anticipate, for developing all of the new cancer drugs going forward in the future.
Mm-hmm. Now, Dr. Lai-Goldman, you have a very personal experience as to why you were inspired to found Genecentric. Can you share that with us?
Yes, certainly, Courtland. Well, I spent, as you said, 18 years at LabCorp. And if you go back to the beginnings of my training and when I started at LabCorp, these were the very early days of HIV. And I had the opportunity during my early years at LabCorp to be involved in developing all of the tests that are now routinely used for assessing HIV and the improvements that patients are having by taking the drugs. So many people hear about the therapies for HIV, but the doctors wouldn't know how to use the therapies if it weren't for these tests or diagnostics that we developed. And it was very impactful for me personally to be involved in the very early stages. As you mentioned, I trained here in New York and was taking care of many people that I had very little to offer to. And then to be able to be involved in really changing the disease to a chronic disease. So that was my early days. Then in 2003, my dad got sick. He became short of breath. And lo and behold, it was very difficult to diagnose him. And here I was a physician, my sister is a physician, and we thought he had lung cancer, but could never make a definitive diagnosis. And to be at that time the chief medical officer of LabCorp and not even be able to help my own father have a definitive and accurate diagnosis and therefore a treatment really made me think there must be something more that I can do.
Yeah, I know Courtland has another question, but I don't want to lose this thought. You know, we hear that story of not being able to be diagnosed or misdiagnosed time and time again. Courtland and I we went to LA to Fran Drescher's conference. She has an organization called Cancer Schmancer. And you know, Fran was misdiagnosed with uterine cancer at a young age because the physicians didn't believe that's what she had. So we hear this story, right, just all
Almost
the
every week.
time. And I guess I have to ask, when you were working in the area of HIV, was the goal, did you say to yourself, we have to figure out a way to make this a chronic condition? Or were you stepping back saying, wow, this is something new and we've just got to figure this out?
I think back then we were taking care of patients and didn't have much to offer. And there was just a tremendous passion, particularly from the patient community, that we have to get all of our acts together and solve this problem. We wouldn't have known enough at that time to know if it would be a cure or a chronic disease. We just had to save lives.
And so out of this experience, you founded Genecentric, and with Genecentric you have this cancer subtype platform which uses genomics to classify tumor types. So can you share with us how exactly this platform works?
Certainly. As you mentioned, I'm a pathologist. And as a pathologist, I'm trained to look under the microscope and to define cancer types. What the cancer subtype platform does is goes beyond what I can see with my eyes under the microscope and looks inside the genes. So it's almost like a more powerful set of lenses that looks inside the cells at the DNA, at the RNA. And by doing that, we can look beyond what we've known today and realize that there are more subtypes within these types of cancer. And they're all different, and therefore they need to lead to different treatments for patients. So the cancer subtype platform defines those new types.
So by breaking down these tumors, we can get at a more sophisticated or a more accurate therapy, or maybe an early diagnosis the right way leading to a therapy. That's just some fascinating work. How do you begin to classify these? Did you develop a starting point, or was there a starting point when you're looking at these to say, you know, this is how we're going to classify them, and develop the nomenclature around that?
Well, this is the work of Doctors Peru and Hayes, and it's what they've been doing for years. It's been the passion of their careers. But as you go deeper, you start to understand not just the surface, but the biology of the cancer. What are the changes? What do they do to make it a cancer? And by understanding those changes, then you can develop a therapy that's targeted to that cancer. And we hear more about the use of targeted therapy, you know, personalized therapy for that individual and that individual's cancer.
Yeah.
So this leads me perfectly into my next question. And so we were just talking about how tumor diagnoses are really important for personalized medicine, but from reading about Genecentric, we've also learned that tumor diagnoses are important for clinical trials. And so are we seeing that this is purely because of the shift in medicine today toward personalized medicine? Or is there something else kind of driving that influence?
No, Courtland, you're right on target. Personalized medicine or precision medicine is being able to give the right drug to the right patient at the right time. Well, that has to start by understanding what type of tumor it is at a very molecular level, at a very deep level, its origins. And so as we move forward, we can know why one patient might respond better to one drug and another patient to a different drug.
You know, that's a great point. And I think Courtland hit on one important topic that I want to talk about just for briefly, and that's clinical trials. You know, I recently read a report that suggested that there are over 800 medications and vaccines in the pipeline today in oncology alone. And as I look back historically, and I look at the products for cancer that have come to market, I have to believe if there's 800 in the pipeline today of medications and therapies, there's probably an equal amount that have fallen out of the pipeline. So I'm wondering, can we use your knowledge and your platform to re-examine some of those products that fell out of the pipeline and reintroduce them back into the pipeline to find these cures for patients?
David, that is a just excellent point, and exactly what our cancer subtype platform can do. Because it may be that patients entered the trial with that broader category, but maybe it's only one of the subtypes that really would have been a responder to the drug. Okay? By using the cancer subtype platform, we can rerun the trial totally focused on what we believe the responder subtype will be. So we really may enable drugs that may be just sitting on the shelf to come off the shelf and have a new life.
Fascinating.
Mm-hmm. So Myla, I know that on Genecentric you have a head and neck pipeline, and then you also have a lung cancer pipeline. So can you tell us, is the work that you're doing in both of these pipelines very similar, or is it quite different?
Actually, it's very similar.
Mm-hmm.
It's very similar methods that are used to develop the lung cancer subtypes, the head and neck cancer subtypes, and really many other cancer subtypes as well.
Mm-hmm. And so the patient direct benefit from these subtypes, it's purely, you know, personalized medicine. They're getting into these clinical trials, and we're figuring out, you know, Dave was successful in this, and Courtland was not successful because although we have maybe the same type of cancer, we have two very different tumor subtypes. Am I understanding this correctly?
Yes.
Okay.
Yes, you.
And
you
so, how does that influence doctors and how they will treat Dave and myself differently?
Well, today it would enable you to be in a clinical trial potentially, where these subtypes could be utilized, and then hopefully in the future it would be able to say which drug would respond to you, and maybe a different drug would respond. You might both have lung cancer, but they have very, very different lung cancers.
Mm-hmm.
And then in the future, once these drugs are approved, then when your doctor is trying to make a decision, which drug do I give you, they would do the test and make the decision in terms of which therapy going forward.
That's very interesting. Mm-hmm. You know, we're in an era of collaboration. Mm-hmm. It's so important. And when I look across healthcare, there's so many stakeholders in the healthcare delivery continuum, right? And especially in oncology, because a patient could have their general practitioner, they could have their surgeon, they could have their oncologist. And so there's many just from the patient side, but bringing products to market, has to be a lot of collaboration. How are you partnering with, say, other medical teams or research centers to really kind of round out the process and look at how are we going to exactly get these products to market faster?
Genecentric is based on a partnership model. We understand that we are one cog in a wheel that centers around the patient. And it's our responsibility to help bring all these stakeholders together, to educate them on the science that we have, to see whether they want to participate either in our studies or run our assays going forward. So we started our work with the Cancer Center in North Carolina. But as we move forward, our circle is growing, our science is growing, and it's also important because the more you include, the more you educate, and the more you yourself get educated on bringing this type of care to patients.
Yeah. You know, we at Healthy h360 are in kind of a similar spot, although we're not on the science end of it. But we kind of think that, you know, we're positioned at the intersection of precision medicine and social media. And so it's encouraging for me to hear you talk about collaboration and the fact that Genecentric is built around a partnership model, because it's very similar to our model. You know, we want to educate patients. We want to vet world-class organizations that bring something to our community, whether it be in oncology or central nervous system or Alzheimer's. And I think that's so important to bring that collaboration together. So, you know, when you think about taking the science and communicating it out, I mean, how do you see that kind of working? Is it through the physician office? Is it through the patient encounter? You know, social media can be a great thing, but it's also a very scary place because there's a lot of misinformation out there. Mm-hmm. So how do you guys at Genecentric look at organizations to partner with and begin to vet some of those, especially more on the advocacy, patient, or social media side?
Well, first I have to thank you for inviting me today, because this is part of educating. We are speaking in many groups, and we participate with many groups such as the Lung Cancer Initiative of North Carolina. But I think that what's most important is to use the word dialogue. Mm. Because learning about new science, it's like learning a new language. Right. And you only learn a new language if you speak it and communicate with it and have feedback about your communication. Mm-hmm. So our goal is to get out to in all different media and all different forum, and really listen as much as speak, educate, not raise false hopes, but talk about the work that we do and the collaboration that we do to, you know, really for the future.
Mm-hmm. Well, Myla, you guys are on the cutting edge of the future of healthcare, and so I'm almost a little scared to ask, you know, what is on the future of Genecentric, but where do you see yourselves going in the next 5 years?
Well, as you mentioned lung cancer and head and neck cancer. We'd like to bring the subtype platform to a broader range of cancers. Mm-hmm. We'd like to expand our partnerships and our collaboration with drug companies and other groups to really help them bring their drugs to market, and really continue to participate so that, as you started, we can really help make cancer more of a chronic disease.
Mm-hmm. We have a few minutes left, and I think this is really important for our community, and I want to get this point out. You shared with me, with Courtland and I, with us, mm-hmm. Before the show, a little evolution of healthcare that had something at the end to do with being the CEO of your own healthcare. And I'm wondering if you could share that with our audience, because I think it's so insightful and it's spot on.
Mm-hmm. Well, if we look back maybe in the last 150 years about what really has improved health and extended life, probably in the early 1900s, it were things done by the government, improving water quality. It's a big issue, improving sanitation. As we look maybe in the mid-1900s, we saw penicillin. We saw improvements in treating cardiac patients. So really, I think the doctor had a big influence in doing that. But really, as we face many of the health issues that we do right now, we really have to be CEO of our own health care. We have to really drive change in ourselves and drive the system to change to serve us better. So that's the way I think of it. In every aspect, it was partly my response to what happened with my dad. It's also, as I look at my own health as I get older, is that we really need to be CEOs, and we have to be ones to make the change.
Yeah, that's a very insightful and a very important point.
Yes, it is.
Yep, and I think that's the perfect place for us to end this conversation. I hope we get invited down to see your office and learn a little bit more. And as always, anytime you're in the area or not, just call up. We would love to have you back on our show and really stay close with you, because I have a personal story, as you know, why I started Healthy O360, and it evolves around cancer. And so I'm very much in tune with what you're doing and really appreciate the hard work that you and your colleagues are doing. So again, thank you so much for coming in.
Thank you.
I'd like to thank the viewers today for tuning in, and I'd like to thank our sponsors for making this all possible. Remember, all of our episodes can be viewed on demand at healthyo360.com, and our podcast can be found in the iTunes store. Courtland, tell us about our social media efforts.
We love social media, and we're all over Facebook, Instagram, Twitter, and Pinterest. We use the hashtag #RealStories when posting, and we would love it if you would do the same. On behalf of Dave Duplay, myself, and the entire Healthy O360 family, we thank you for joining us this afternoon. We hope you have a great day, and we look forward to seeing you next week when we're speaking with Sharon Manor of Ashrams for Autism.